Hello everyone. The topic of my lecture is retina, an overview. In my lecture, we will get to know the anatomy of retina and the diseases associated with retina. So retina, it is a very important part of our eye. It is the innermost tunic or layer of the eyeball, which is thin and delicate and transparent membrane. It is mostly highly developed tissue of the eye. It appears purplish red due to the visual purple of the rods and the underlying muscular choroid. So this is how our normal fundus looks. So it is pinkish in hue with optic disc in it, retinal vessels in it, and macula lutea, which is a darker red in color and temporal to optic disc. And this both things comprises of posterior pole of the retina. We will get to know what is posterior pole, what is posterior fundus, what is peripheral fundus in my upcoming slides. And this is why we are here to understand anatomy of retina. So, gross anatomy. Retina extends from the optic disc to the ora serrata. Grossly, it is divided into two distinct regions, posterior pole and the peripheral retina, separated by the so-called retinal equator. Now, what is retinal equator? So, retinal equator is an imaginary line which is considered to lie in line with the exit of the four vena verticosa. Now, what is vena verticosa? These are veins which are presented in the retina at the location 1 o'clock, 5 o'clock, 7 o'clock, and 11 o'clock in position. And by joining all these four vena verticosa, an imaginary line is drawn, retinal equator. And this retinal equator, so here we can see, just imagine here at 1, 5, 7, 11, there are vena verticosa. Peripheral to this also retina is present. So this is posterior pole and this is equator, just imagine. So it is an imaginary line joined, a line drawn joining 1, 5, 7, 11 position of vena verticosa, and this imaginary line is known as retinal equator. Retinal equator, we have posterior to it is posterior fundus present, and anterior to it is peripheral retina is present. So posterior retina, posterior pole of retina comprises optic disc and macula lutea, and peripheral to equator is peripheral retina. So retina extends from the optic disc to the ora serrata. So here we can see retina from optic disc to ora serrata. Now I will tell you what is ora serrata. Now equator is an imaginary line which separates peripheral retina from central retina, and where peripheral retina ends, this is not in the picture, you have to imagine it. So it ends at the ora serrata. Now what is ora serrata? Ora serrata is an area where retina ends. So retina extends from the optic disc to the ora serrata. Grossly, it is divided into two distinct regions. I have told you earlier what are those distinct regions: posterior pole and peripheral retina, which is separated by the so-called retinal equator. The retinal equator is an imaginary line which is considered to lie in line with the exit of the four vena verticosa. I have told you about it in earlier. Now, posterior pole, what is it? Posterior pole refers to the area of the retina posterior to the retinal equator. I told you in my previous slide. The posterior pole of the retina includes two distinct areas, the optic disc and macula lutea. Again, we can see here optic disc and macula lutea. The posterior pole of the retina is best examined by slit lamp microscopy using 78D and 90D lens, and also by direct ophthalmoscopy. So this can come you in pre-PT exam and MCQs, that what is the best way to examine posterior pole and optic disc or macula. So the best way to examine is 78D and 90D on microscope, slit lamp microscope, and also by direct ophthalmoscopy. Whereas peripheral fundus is best examined by indirect ophthalmoscopy using 20D condensing lens. I will tell you this in my upcoming slides. Now, what is optic disc? I have told you earlier, and I have also, you can see in this picture, this is optic disc. How it is looking? It is oval in shape with this pinkish in color, and there is a small depression in center of it, this optic disc, which is known as optic curve, from where central retinal artery and veins arise, which then divide into various retinal arteries and veins. So this is the anatomy of optic disc, which is present in the posterior pole or central retina. So it is pink colored, well-defined circular area of 1.5 millimeter in diameter, At the optic disc, all the retinal layers terminate except the nerve fibers which pass through the lamina cribrosa to run into optic nerve. A depression seen in the disc is called physiological cup, and from where the central retinal artery and vein emerge to the center of this cup. Now, macula lutea. What is macula lutea? Optic of posterior pole comprises of optic disc, which I have told you what is it. Now, the turn is of macula lutea. It is also called the yellow spot. It is comparatively deeper red than the surrounding fundus and is situated at the posterior pole temporal to the optic disc. Again, I will tell you this picture. It is deeper red in color as compared to the peripheral pinkish retina, and it is situated in temporal to the optic disc. So it is comparatively, macula lutea is comparatively deeper red than the surrounding fundus and is situated at the posterior pole, which is temporal to the optic disc. Now it is about 5.5 millimeter in diameter. Now the macula lutea again consists of various parts, which I will tell you in my upcoming slides. It consists of one part which is central to it. So the name is fovea centralis, which is central depressed part of the macula lutea, and it is about 1.5 millimeter in diameter and is the most sensitive part of the retina. Now, this is how the anatomy of macula looks. It is divided into 4 zones. Central, so this is macula, then it is center to it is fovea, and again center to fovea is fovea centralis. So the diagram to draw the anatomy of macula can come in your examination. So again, the anatomy of macula, the macula lutea is the dark area, 5 millimeter in diameter, situated at the posterior pole of the eye, and it is situated temporal to the optic disc. Fovea centralis is the central depressed part of the macula. Now it is 1 disc diameter at the center of the macula. Now at the foveola is the again center to the fovea is the foveola, which is the again the central part of the fovea centralis. Now macula has central part which is 1.35 millimeter, which is a fovea, and again center to it is foveola, which is central point of the fovea and is 0.35 millimeter in diameter. It is the thinnest part of the retina. It consists of cones only, and hence it is responsible for maximum visual acuity. So if anything happens or any lesion happens in the foveola, so our visual acuity will be most affected. Whereas any lesion occurs in other part of the retina, our visual acuity will minimally be affected. Hence, our maximum visual acuity is important part is macula lutea, of which fovea centralis is again the most important part, and of it foveola is the most important part for and is responsible for our visual acuity. So to revise, this is the retina, central posterior fundus or posterior retina, which comprises of disc, which is pinkish in color, and central depression, optic disc cup, from which central retina and veins arise, and is divided into various retinal arteries and veins. Temporal to it, 5.5 millimeter is 5.5 millimeter. Temporal to is deeper red color. Macula lutea is present, and center to it is fovea centralis. Again, center to it is foveola. So this is in brief the posterior fundus. Now in the center, again we are coming back to the macula. In the center is shining of the foveola centralis is a shining pit called foveola, which is 0.35 millimeter, which is situated about 2 disc diameter. Always remember, 1 disc diameter is the size, the diameter of the disc is always 1.5 millimeter, and this is the measuring when we can use this disc diameter as a part of measuring in different lesions as for distance and shape and size. So 2 disc diameter, that is 3 millimeter away from the temporal margin of the disc and about 1 millimeter below the horizontal meridian. This foveola is situated. An area about 0.8 millimeter in diameter, which includes foveola and some surrounding area. It does not contain any retinal capillaries, and this area is called foveal avascular zone. This foveal avascular zone has importance in for FFA, fundus fluorescent angiography, which signifies diminished foveal avascular zone or increased foveal avascular zone, and increased foveal avascular zone in FFA denotes ischemic maculopathy. This is we will get to know in upcoming slides. Now the surrounding the fovea are the parafoveal and perifoveal areas. Now peripheral retina. What does peripheral retina means? Peripheral retina refers to the area bounded posteriorly by the retinal equator and anteriorly by the ora serrata. Peripheral retina is best examined with indirect Peripheral retina is best examined with indirect ophthalmoscopy. I have told you earlier in my previous slide. Again, I will repeat. Posterior fundus is best visualized by 78D and 90D lens, plus 78D and plus 90D lens on slit lamp biomicroscopy, and also by direct ophthalmoscope. Whereas peripheral retina is best examined with indirect ophthalmoscopy and by the use of Goldman trimirror contact lens. Now, what is ora serrata? As you all know, anterior to equator and posterior to ora serrata is peripheral fundus, and this is the margin of peripheral fundus or peripheral retina. So why it is known as ora serrata? Because it is serrated peripheral margin of the retina where the retina ends. Here the retina is firmly attached both to the vitreous and the choroid. And this is a very important structure anatomically, because here various lesions, retinal detachment and various peripheral retinal degeneration lesions occurs near to it. Hence, to know about ora serrata, it is very important to know. Here it is here where retina is firmly attached to the both vitreous and choroid. The pars plana of now anterior to ora serrata, where ora serrata and the pars plana starts, and pars plana extends anteriorly from this ora serrata. Now we get to know all the different regions of retina. Now the various layers of retina. Now this is a diagrammatic representation of the various layers of retina. Now it comes in your pre-PG examination and also as MCQs in your theory. What are the how many layers are there in retina? So if you are if you're asked what are different layers of retina, how many layers of retina, we should always tell 10 layers. But when you are asked how many layers are there in neurosensory retina, you should always say it is 9. Now I will tell you what is difference between retina and neurosensory retina. So first let us know what are the different layers, 10 layers of the retina. So retinal pigment epithelium, rods and cones, external limiting membrane, outer nuclear layer, outer plexiform layer, inner nuclear layer, inner plexiform layer, ganglion cell layer, nerve fiber layer, internal limiting membrane. So this, anytime you mention layers of any structure, you should always tell from inner out or out to in. It means, so these are layers. So innermost layer is internal limiting membrane and outermost layer is retinal pigment. After this retinal pigment epithelium, choroid starts and choriocapillaries. So this is the outermost layer, and innermost layer where the light is incident is inner limiting membrane. So always remember. So all these 10 layers comprises of retina, but neurosensory retina, where the sensation of light occurs and which are responsible for light sensation, is 9, which start from rods and cones to inner retinal, internal limiting membrane. RPE is not involved in when you are asked neurosensory retina. If you are asked layers of only retina, there are 10 layers which includes retinal pigment epithelium. But when you are asked different layers of neurosensory retina, you should skip retinal pigment epithelium and you should say only 9 layers from rods and cones to internal limiting membrane. So I think you very well understand the difference between retinal layers and neurosensory retina. There is only difference of retinal pigment epithelium. Again, this is a diagrammatic representation, and the mnemonic I have written here to memorize it. From outer to inner, 10 layers of retina, RLE, O2, 2 times O, 2 times I, GNI. So R for retinal pigment epithelium, layers of rods and cones, L for E for external limiting membrane, O for outer nuclear layer, O for outer plexiform layer, I for internal nuclear layer, inner plexiform layer, then ganglion cell layer, nerve fiber layer, and internal limiting layer. So I think this will help you to memorize it, and it is very important to memorize the different layers of retina and to know the difference between neurosensory retina and normal retina. The only differences of retinal pigment epithelium. Again, we have after my class we get now we can very well understand the various part of our posterior part of the eye, optic nerve, fovea, then retina. Behind retina is choroid. Then we after choroid is sclera. Ora serrata is the region where retina ends. Now this is how our fundus has been divided. Central fundus is divided in comprises of optic disc and macula. Then equator comes, which divides our retina in central retina and peripheral retina. Peripheral retina ends at the ora, after which pars plana start, and this is the ora serrata, which has serrations. So I think we can now very well understand the anatomy of retina. So because until and unless we don't know the anatomy of any structure, we can never understand the pathologies or diseases associated with that structure or that part. Hence, I think we very well understand the different parts of retina, various important structures of the retina. Now we will understand, I'm starting different diseases of retina. So I will start with retinal vasculitis.